Hi, I'm Dr. Prakrutha, IVF and fertility specialist at Aster CMI Hospital, Bangalore. Today, let's talk more about IVF. There are many questions that still remain unanswered. Just the basics as to how the IVF journey would be, what all should I expect, what all as a couple do we go through. These are some of the very common questions that the patients ask. Overall, every couple have been probably briefed up about the whole IVF cycle and what it all takes, but still there are many unanswered questions. Let us have a look into each of these. The first and foremost, when you are about to begin your IVF cycle, usually the doctor asks you to come on your day 2 of your periods or day 3 or maybe the first day for a baseline checkup. That would include an ultrasound scan and a few hormonal blood reports, based on which your further injections and medicines would be decided. So the following days would start up with a line of injections for a couple of days, say 4 days or 5 days, and then again a review scan to check how your follicles have been growing up. So this is called as follicular monitoring, and this helps us in titrating your medications and giving you an optimum result. So the follicular scans can be any number. It may be 3, it may be 5, it may be 8, depending upon your response. The days of stimulation, that is the number of days of total injections, also roughly depends upon how your body would respond. On an average, any IVF cycle stimulation would approximately take 10 to 12 days. Some cases it may be more, up to 14 or 15 days. Some cases it may be even less, say around 9 days. So once the follicular monitoring cycle goes on and the follicles grow up to a particular size where your clinician or the doctor feels that this is reached up to a right size, so this is where you are given a timed injection. This is called as a trigger. Now this trigger is for the maturation of the eggs. So approximately 34 to 36 hours after this injection is the egg pickup. So if you are taking the injection one particular night, the next following day would be a free day and the next day would be the procedure. The procedure is usually done under IV sedation or anesthesia, depending upon the patient request. So under anesthesia, using a transvaginal probe, using it as a guide, we go into the follicles, aspirate the follicles, remove the liquid out of the follicles, that is the follicular fluid which contains an egg, and this is sent into the lab where the egg pickup is done. So wherever the eggs are seen within the fluid, the eggs are collected and they are transferred into culture dishes. So this is where the eggs are further cultured for further maturation. Post pickup procedure, usually the pickup may last say around half an hour, not more than 45 minutes, and then once you are stabilized, you would be shifted back into the recovery room. Post recovery or observe for say up to 4 hours, and if all the vitals are stable, patient is comfortable, that day itself the discharge can happen. What happens in the lab after the pickup, right? So on the very same day of the egg pickup, we ask your partner, your spouse, to give us a semen sample. If the partner is available then and there, many a times we may also use a frozen sample, which is also fine. So a fresh semen sample is processed and then the sperm selection process begins. So how does the sperm selection process happen? All this happens inside the IVF lab. In the lab, the sperm selection happens under a high vision microscope where the right sperm is selected and each sperm is injected into one egg. And the following day, this is again observed if there is any fertilization process happens. So once a fertilization happens, what we call as a 2PN. So basically that is what is looked for. So there are 2 pronuclear bodies within the egg which confirms us that an embryo has formed, which confirms us that there is a fertilization of the egg along with the sperm. This is again further cultured and observed for further growth of the embryo, for the cleavage of cells is what we call as, that is nothing but the division of the cells. So there is formation of cells, and there is division of new cells, and there is formation of more cells. This is how these embryos are cultured until day 3 or day 5, and as per the best protocol that is suited for you, it may be a fresh transfer or a frozen transfer, the embryos are used. If it is a freeze-on or the embryos are not being transferred in that very cycle, it is going to be frozen. That is, all the embryos are going to be frozen, and then we wait for a new cycle of yours, and then prepare your lining separately and then do the transfer of those embryos. In case if everything is very concordant and very suitable for an embryo transfer in that very cycle, what we do is a fresh transfer, where right after the pickup, maybe 4 days or 6 days after the pickup, we do the embryo transfer. This is called as a fresh embryo transfer. For more queries on IVF, please contact IVF department at Aster CMI Hospital. Thank you.